To perform specific traction, we want to isolate it to one segment. The most common nerve root to be pinched in the cervical spine is C6, and this exits between C5 and C6. So if the patient has nothing wrong with their cervical spine above, we can lock it and put all of our traction force at the target segment. So let's pretend she has a right irritable C6 nerve root, which exits between C5 and C6. I'm going to flex the neck down to C5, but not C5-6. I'm going to side flex away to the left, down to C5, but not including C5-6. Then I'm going to rotate to the right, the opposite or contralateral direction of the side flexion, which will tighten up and snug or lock everything from C0 down to C5, leaving the C5-6 segment in neutral. Then I will apply the traction force. I prefer a football grip. I'm going to put my forearm on the pillow, place her head on my forearm. My hand will go around her chin, but I will not be using that to pull. It just lands there. My other hand, I'm going to palpate the interspinous space between C5 and C6. Then I'm going to snuggle in with her head, and I'm going to flex down to C5-6 by extending my knees, using very little arm work whatsoever. So I'm going to flex, 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 flex until I feel C5, move on C6, stop. Now I'm going to move my body to induce side flexion to the left until I feel C5-6 move and I stop. Then I'm going to add some rotation until I feel C5 starting to move on C6. So now C0, 1, 2, 3, 4, 5 are all flexed, side flexed, and rotated and nice and snug. So now using my legs, I'm going to push my body cranially and her head, and everything down to C5 is coming with my body. I can feel with that second finger the separation of C5 from C6. It's a very, very gentle movement, and I am going to decrease the compressive forces on the facet joints. I'm going to open the intervertebral foramen, which reduces the pressure not only on the nerve root, but very importantly on the blood supply to the nerve root. And I'm going to do this for a couple of minutes, making sure I'm not working too hard so that I can do this for at least 2 minutes. And that's how you perform specific traction to C5-6.